Welcome to The Explainer. Today we're going to dive into the incredible 50-year story of how one of the world's most populous nations built its health system, really from the ground up. It's a journey that takes us from the birth of a nation all the way to the massive goal of universal care for all.
Okay, so before we jump in our time machine and go back 50 years, let's get a quick snapshot of where Bangladesh is right now. And to really get it, you've got to understand what we even mean by a health system. Just think of it like this giant, complex web. It's all the organizations, the people, the actions, everything working towards one single goal: keeping people healthy. And for a country with over 170 million people, yeah, that web is seriously intricate. And if you want to see just how far they've come, well, this number kind of says it all. The average person born in Bangladesh today can expect to live 72.6 years. Now, get this. When the country first gained independence, that number was down around 46. So we're talking about a massive, massive leap forward.
But, and this is a big but, that success story has a really painful side to it. Even with people living longer, the system still struggles to protect some of the most vulnerable. For every 100,000 babies born, 156 mothers will not survive complications from childbirth. It's just a stark reminder that progress doesn't always reach everyone equally.
And that struggle continues right after birth. For every 1,000 babies born, 21 won't live to see their first birthday. So you see this contrast, right? You've got a country where people are living longer than ever before, but at the same time, these fundamental risks for mothers and their newborns are still very real. So how do we get here? Well, to figure that out, we've got to rewind the clock.
All right, our story kicks off right where the nation's story began, in the chaotic aftermath of the 1971 Liberation War. A brand new country had to figure out how to build a health system basically from scratch.
You can see the whole journey broken down right here into these big chunks of time. Before 71, during the colonial era, healthcare was really a luxury item, something for the wealthy folks in the cities. But after independence, that entire philosophy got flipped completely on its head. The new mission was to build a system for the public, with a laser focus on primary care and reaching the millions of people living out in the villages.
And you really can't overstate just how revolutionary this idea was at the time. The government was really inspired by this landmark global agreement called the Alma-Ata Declaration. Its core message was simple: health for all. This wasn't just some fancy policy talk. It was a promise to build a system based on the public good, not on how much money you had. The whole idea was to get healthcare out of the big cities and bring it directly to the villages, especially for mothers and their kids.
So the foundation was there. But the next couple of decades, this is where things get really interesting. This was a period all about building on that foundation with some super smart, innovative programs that honestly put Bangladesh on the global health map. Two things from this era were just absolute game changers. First up, you had the expanded program on immunization, or EPI. This was a huge public health push that got vaccination rates for kids way, way up. And second, there was this incredible model from an NGO called BRAC, which trained and empowered local women to become community health workers.
And the real genius of that community health worker model was how simple and brilliant it was. It was all about trust. See, instead of making people travel for hours to some big, intimidating hospital, it brought healthcare right to them. By training local women, people who were already trusted figures in their own villages, it just broke down all these barriers and delivered vital care, literally to people's doorsteps.
Okay, let's fast forward to the modern era. All that past success created a much bigger, more complex system. And, well, with that complexity comes a whole new set of 21st century problems.
The system today is pretty much a mix of three major players. You've got the public sector, run by the Ministry of Health. Then there's this booming private sector with all its hospitals and clinics. And finally, you still have the crucial support from NGOs and international partners. The big challenge now is just getting all these different parts to work together, to talk to each other effectively.
And the single biggest challenge they're facing is something experts call the double burden. Okay, so think of it like this. The country is fighting a war on two fronts at the same time. It's still battling those infectious diseases, the health problems of the past. But because people are living longer, it's also seeing this huge spike in lifestyle diseases like diabetes and heart problems, the health problems of the future.
And the hurdles are pretty big. Getting care in rural areas can still be tough, public hospitals are often packed, and there just aren't enough trained doctors and nurses to go around. But check this out. This last point is maybe the biggest one of all.
Over 60% of all healthcare costs are paid directly by patients, right out of their own pockets. That means for a lot of families, one bad illness can completely wipe them out financially.
So that's the problem. What's the solution? How does the country get over these hurdles? Let's take a look at what's on the drawing board for the future.
So the plans for the future are designed to tackle these exact problems. To deal with that huge out-of-pocket cost, the big push is for universal health coverage. To help close that gap between the cities and the villages, they're leaning into things like telemedicine and digital health. And to make funding more stable, they're looking at ideas like mandatory health insurance for everyone.
And it's super clear. There's no one-size-fits-all answer here. Just take a look next door, at India. They took a totally different path. While Bangladesh was busy building this huge network of over 14,000 community clinics, India launched this absolutely massive insurance program. Now, both countries still have trouble reaching rural areas, but here's the key difference. That direct grassroots approach in Bangladesh seems to have given it a real edge when it comes to child survival rates.
At the end of the day, this whole 50-year journey shows that building a health system is about so much more than just buildings and budgets. From those community health workers in the 90s to the digital health of today, the fundamental challenge has never really changed. As the system keeps evolving to face the next 50 years, the question is still the same as it was on day one. How can you make healthcare truly, and I mean truly, serve the people who need it most?